I'm going to talk about type 2 diabetes and one of its complications known as macrovascular disease, and in particular peripheral artery disease. So what is diabetes? Well, diabetes is a chronic disease in which there is high blood sugar levels in the body, which is caused by 1, inadequate insulin production, also known as type 1 diabetes or insulin-dependent diabetes. 2, the inability of the body to efficiently use the available insulin, a condition known as insulin resistance, or both inadequate insulin production and inefficient use of available insulin. And this is found in type 2 diabetes, also known as non-insulin dependent diabetes. So this chronic high blood sugar level, also known as hyperglycemia, can lead to complications, and one of these is called macrovascular disease. So what is insulin and how does it work? Insulin is a hormone produced by the pancreas, an organ that sits behind the stomach. Insulin assists the entry of blood sugar into muscle and fat tissue for energy production, and it also assists the liver to process and store blood sugar in the form of glycogen. So as you can see, that is the pancreas there, just under and behind the stomach. What is macrovascular disease? Well, basically, macrovascular disease is the deposition of fat known as cholesterol within the walls of the large blood vessels, which would eventually narrow and block. And this is also called atherosclerosis, the deposition of this cholesterol in the walls, and can lead to heart attacks and heart failure, also known as coronary artery disease. It can give strokes and mini strokes, a condition known as cerebral vascular disease, and it can lead to poor blood circulation in the limbs, especially in the legs, a condition known as peripheral artery disease, and this is what I want to talk about in a little more detail. So you can see that is atherosclerosis there, with this blood vessel is clear, but this one has quite a lot of cholesterol in the wall, and the blood vessel has been narrowed. How common is peripheral artery disease? Well, the estimates are that 200 million people worldwide have peripheral artery disease, and out of these, 20 to 30% will have diabetes. And in fact, this is an underestimate for diabetes because a good number of people with peripheral artery disease have no symptoms. And also in diabetes, you find that there's reduced sensation in the legs. Up to 30% of those above the age of 50 will have peripheral artery disease. And amputations are up to 15 times more common in diabetes. So what are the risk factors for peripheral artery disease? Well, diabetes is one of them, and peripheral artery disease is increased by up to 4 times in diabetes. Smoking, people who smoke have a risk 4 times more than those who don't smoke, and it's probably one of the most important modifiable risk factors for peripheral artery disease. The other risk factors are high blood fat or cholesterol, high blood pressure, obesity, physical inactivity, and also increasing age. What are the symptoms and signs of peripheral artery disease? Like I said earlier, up to 50% of people with peripheral artery disease will have no symptoms at all. But for those who have symptoms, the typical symptom is that of pain on walking, mostly in the calf. So they'll walk a certain distance, the pain will come on, they stop and rest, the pain goes away, and when they resume walking after a certain distance, the pain comes back. They can also get numbness or just fatigue in the calf, behind the thighs, or in the bottom. They can have rest leg pain. This is seen when the blockage is very severe. The pain is worse at night, and the patient will get relief with the legs hanging over the bed. They can get foot ulcers, and also they can get gangrene. Gangrene is basically just dead tissue, which can lead to amputations. And this is seen when the blockage is very severe, or it is complete. It rarely affects the arms, but when it does, the symptoms are basically the same. They come on with use of the arms and goes away when the arms are resting. So here, these are just pictures of that would be an ulcer there, and this is gangrene. That is gangrene, and this is where one can feel for the foot pulses. How can one make a diagnosis of peripheral artery disease? Well, firstly, it's from the history, of pain, walking, which goes away when resting, and this kind of pain is also known as intermittent claudication. Yeah, so a history of intermittent claudication. On examination, the pulses would be reduced or absent in the legs, in the feet. The calf muscles would be small and weak. The legs and feet would be cold to touch with skin color changes. If you elevate the foot, you find that the skin comes pale, and if you put in the dependent position, it becomes dusky red. There will be loss of hair on the shins, and there will be some nail changes which grow rather slowly. The other way of making a diagnosis is to do some tests. And one of those is an ultrasound scan, which can measure blood flow, and it can also show you the site and the extent of the narrowing. The other test is what is known as the ankle brachial index. This is just the blood pressure difference, that is the systolic blood pressure difference between the ankle and the arm. And a value of less than 0.9 indicates the presence of peripheral artery disease. So this particular value correlates very well with severity, but not with functional impairment. So someone can have a value of less than 0.9, but they're able to function fairly well without any pain. So the other test is what is known as angiography. This is basically a test where dye is injected into the blood vessels and pictures are taken. This can be taken by just a normal X-ray, or the more advanced ones like the CT scan or MRI scan. And this is just an example of what an MRI, an angiogram would look like. These are blood vessels, and you can see little defects there, showing that there's some narrowing there. So, what are the treatment goals for peripheral artery disease? Well, firstly, you want to relieve the pain on walking and exercise. You want to increase the exercise tolerance. You want to prevent blockage, critical blockage that is. You want to avoid gangrene and subsequent amputations. And generally just to reduce the overall cardiovascular deaths and then wellness. Some of the treatment modalities that you can use are lifestyle changes, where you stop smoking, eat a healthy diet, exercise, and lose weight, adequate control of the diabetes, the blood cholesterol and blood pressure, and also supervised exercise. Supervised exercise is basically a treatment to increase exercise tolerance. So the patient will be put, for instance, on a treadmill. They are made to walk really fast. When the pain comes on, they stop. When the pain goes away, they start again until the pain comes, and this is done over a period of time. And it's been shown to improve exercise tolerance, so one is able to walk longer before the pain comes on. Other treatments would be to use medicines like blood thinning medicines, like baby aspirin. Those improve blood flow. We can use blood vessel dilators, and there are some which are specific for peripheral artery disease, and also some drugs that reduce the stickiness of the blood so that the blood is able to flow freely. If all fails, then surgery can be offered, and one of the procedures is what is known as angioplasty, basically where the area of narrowing is dilated using a catheter and a balloon, and a stent can be left there. A stent is basically a wire mesh tube which can expand to increase the dilatation of the artery. If all fails and the disease is very advanced, then bypass surgery can be offered. This is where a vein or an artificial blood vessel is attached to the blood vessel above the narrowing and below the narrowing. So this is a picture of angioplasty. As you can see, you know, the catheter there, and there's a balloon there which has been expanded, which is expanding the stent, and the stent has been left inside there, the wire mesh, and you can see that the blood vessel has been dilated. And that is a picture of the bypass. You can see there the bypass attached above and below the narrowing. So in conclusion, peripheral artery disease is more common than previously thought, but it's still under recognized and undertreated. And yet it has very devastating social, psychological, medical consequences from ulcers and gangrene, and therefore early detection and treatment are of paramount importance.